Hi everyone, welcome to another video. I received another question about Symbicort, which is basically this inhaler. Seems to be a popular topic that I get a lot of questions about this, but I'll try to answer as many as I can. So, is there any short-term or long-term effects of using Symbicort? So I will try to understand what the question refers to, and I'll try to explain it based on my understanding of the question. So basically, I will start by saying that Symbicort is one of these inhalers that you can use both as a reliever and a controller. So for example, in the treatment of asthma, this is where this applies mostly to. So if you're using an inhaler such as Symbicort as a controller, it means that you're taking it regularly for a very long period of time. So you're taking it maybe every day, twice a day for months, years even, and that's absolutely fine. It's used to control your disease. That's why we call it a controller. And we use it because it contains two medications inside. One is a bronchodilator, something called Formoterol, which basically opens up the airways and helps you breathe better and lasts for quite a bit of time. So about 12 hours you may feel an effect from the inhaler. And it also contains a corticosteroid, which is a medication which acts as an anti-inflammatory agent, which controls the inflammation in the airways and helps prevent further asthma attacks. However, because you use it as a controller, it doesn't mean that in the case of Symbicort you cannot use it as a reliever as well. And because I mentioned that medication Formoterol, that's a bronchodilator. It's a medication that opens up the airways, but the good thing about it is that it acts quite quickly. So you should feel an effect within 5 to 10 minutes of taking the inhaler. You should feel your breathing easing a little bit. So if you're having an asthma attack, this can be used in that situation. However, it's also a good idea to probably have around a blue inhaler, such as Ventolin or something similar, in order to use it more, basically, because it depends on the severity of your asthma attack. For something mild, probably you can use this as a reliever, and that's a short-term effect. But the long-term effect you really see after months of use, and generally with asthma, you will have a stepwise treatment. So basically, your doctor might increase the dose, then, for example, monitor you for about 3 months' time. You go for another checkup, and then they may decrease the medication to less puffs or lower dose inhaler, then continue for another 3 months, then step it up again or step it down depending on your symptoms. So basically that's how the treatment is given in asthma. It's a stepwise approach, but Symbicort is one of these inhalers that you can use also as a controller, as a long-term treatment, but also as a reliever. So that's a good thing. It's not the only inhaler that can do that, so there are some others as well. So it's important to talk to your doctor what kind of inhaler you are on, what does it do, what can you expect it to do in your case for your condition. So this isn't necessarily the best inhaler out there or the worst inhaler out there. For each person, really, there is a specific inhaler that they manage best on. So this is something that you need to discuss with your doctor. There's a wide range of inhalers out there, and many of them do similar things. Some are better than others depending on how well you can use the device as well, because that's also a main thing. Thank you for watching this video. If you have further questions, do leave them in the comment section below, and I'll be happy to answer them in future videos. All the best and good health.